So to anyone listening, what it would be like is the only way I could see Rupa's face is if she were literally 1 inch in front of me.
Yeah,
my watch has to be in front of me, which is very helpful now that I'm older to be able to pluck my eyebrows, things like that. But it's really hard. And actually, I never realized how insecure it makes you feel until recently, as I've gotten older. And I started wearing glasses when I was 8 years old, and I'm now 55, so I've had to go through the whole gamut of it. But I really felt like, what if something happens and I lose my contacts or my glasses? So now when I fly, I have to wear a little fanny pack because I want to make sure that if the plane crashes and I survive, I have contacts and glasses with me at all times. What if there's a supply chain issue and they can't get me my contacts and I've lost my glasses? I literally joke that I will not be on your zombie apocalypse team because I will be of no good use to you. Leave me by the side of the road.
You're done.
Yeah, so it's terrible.
I think the thing is, for those of us that don't wear glasses or aren't nearsighted, we don't really understand. My husband's also -6.5, and I just didn't get, like, you can't see the shampoo bottles in the, you don't know what's like shampoo and conditioner. I mean, I don't.
You would look like a very kind of like a light peachy fuzz.
Okay.
And then a burgundy fuzz and white fuzz because of those 3 colors. That's all I would see. So it really is a strange, strange feeling. I mean, I can get around my room because I know where it is. But if you asked me to then go downstairs, go outside and get into the car, I could get there, but then I would not. There's literally no way you would be able to do anything else.
Now, so did your eye doctors tell you it's not just the glasses, like, we're concerned about your eye health? Did they talk to you about, hey, you're -8, so you're at a really increased risk of retinal detachments? That must have been a scary conversation.
Yes. I mean, yes and no. I come from a family of high myopes.
Okay,
I've
so
seen a bunch of my cousins who've known it. And if I'm being really honest as a physician, I wasn't always as good about going to the eye doctor, and I would order my own contacts. But finally, because this is what everyone should be doing, I went and saw a retinal specialist who does a very thorough retinal exam, which, by the way, is to me worse than a pap smear. But now there's machines.
I disagree. But
now there are machines.
Yes.
He was doing the
old-fashioned way.
But
when they press on your eyeball, when they're doing it, it is hard.
But I recognize that it's really valuable. So yes, they did make that clear. And actually that was outside of, again, the anxiety and insecurity and just the cost of wearing contacts and glasses, which is a lot, as you know. It was that aspect. I kept saying to my children when I would fight with them at the beginning that I'm saving you from a lifetime of not being able to see and also potential risks.
Okay, and that's key. And that's what I try to tell parents too. It's not just needing the glasses or the contact lenses or being not useful during a zombie apocalypse. It is the fact that their vision is literally at risk. But when did you first notice the kids' nearsightedness? You must have been pretty attuned to it. Because
Well, my oldest had been born with some issues because he had actually suffered a traumatic brain injury in utero. And so he was signed up to see an ophthalmologist for his whole life. And so up until he was about somewhere between 10 and 12, we're not exactly sure of the dates because I'm a mother and a doctor and I forgot. He was wearing glasses, and we recognized that neurologically his vision was never going to be perfect. And I said, he's gotten my vision, it's fine. And the second one was already starting to show signs of it as well, just by, and I don't understand eyes despite being an OBGYN, but measuring, they were able to detect.
That's what we do.
But our eye doctor, who's wonderful, Dr. Brian Campolatero in New York.
He's great.
He's so good. He immediately said, listen, we have this technology that apparently had been used in Asia for decades. Who knew? It was off-label in America at the time. He sent me to a specialist in Manhattan, an optometrist, not an ophthalmologist, who does all the measurements. And that's when we started it back when it was Ortho-K, meaning only the hard lenses. We talked at the time about the choices of using hard lenses versus atropine, and I don't understand all the differences, but it seemed like the best results were going to be from Ortho-K.
Okay, and tell people, like, when was this? Because this
was somewhere between 7 to 9 years ago. This was a while ago. And we would have to go from Connecticut into Manhattan. When I say we, it was me once and it was my husband all the other times because I was working. And we would fight with my then, again, if it was 7 to 9 years ago, he was 12 to 14 years old. We would fight because if anyone's ever worn hard lenses, and these were not those small hard lenses that just cover your pupil, right? It's a hard lens that looks like a soft lens that covers your entire iris. That, correct me if I'm wrong, changes the shape of the cornea.
So you sleep in those contact lenses, which it's not my favorite treatment now because we have the soft contact lenses, but 8-9 years ago, there were no soft contact lenses.
And it was miraculous. He would sleep with them. And at the time, I want to say he was between a -2 and a -3. He would sleep with them overnight. He would wake up, take them out, and then he could see with nothing through the day. Which was, to me, a fascinating idea. I could not believe.
It literally changes the shape of the cornea, the clear dome shape covering the eye. But it requires a lot of parental involvement, which is what
I have to tell you. as a mother who's a physician,
Yes.
there's a lot of hands-off approaches that I purposely, intentionally take, partially because I don't have the time and partially because I think it's better. Our kids should be independent and resilient, and I'd let them make certain decisions that I might not agree with, but okay, these are your choices. Things like their clothing. This was something where, I mean, if anyone listened to our household, they would for sure think that there's something wrong because we would both be screaming at each other, crying. Like he would be crying, I would be swearing because these hard lenses are hard to put in. They're tricky to put in. You have to use the plunger to get out. We lost the plunger? Where was the plunger?
Yes.
And it took, I would say, a good couple of months to really get into the groove. But it was the one thing where I said, no matter what we do, this is the one thing I am not letting you let go. Because he would say, it doesn't matter, I'll wear glasses.
Yeah, it's not just
and
that.
I wouldn't let him. Because I knew that if he got to my stage and I could prevent it, for sure I want to prevent it.
Yes.
So now we're at the point where thankfully all three of them are now in it, but they all three had to do the hard ones.
They did the hard ones first.
So, and now they're in the soft, and now he's actually in just atropine eye drops with regular lenses. And the truth is, the frustrating parts for us were like, it was hard to go into the city all the time. It was very expensive. But I kept saying, I'm going to calculate the amount of glasses and contact lenses I'm going to be saving, which I guess, and you can tell us more about these details.
Yes.
I think it's important to manage expectations, right? It doesn't mean your kids are never going to have to wear anything. It's that they're not going to get as bad as a -8. And that's the part where, as a mother and as a high myope, I really want to highlight this point to the parents. I think it's easy if you wear a -2 to be like, well, what's the difference? -2, -8?
Yeah.
It is such a massive difference that it's like, of all the things I've been through medically, which is a lot, this is the one thing where if I could prevent it, I would prevent it. And I say that, and I've gone through a lot.
And you've
of
gone through a lot because I know your journey and all the different surgeries you've had.
And this is the one thing that we can prevent. All the other things I've been through, I probably can't prevent.
You can't prevent.
But this I can. I feel like it's a no-brainer, even if it's hard, even if it actually costs time and money for patients. I would so strongly encourage it. And not enough people know about it.
That's the thing. That was the other thing that you and I were talking about earlier, is that you didn't initially know about these treatments.
I knew nothing about it. And by the way, I have now since told pediatricians, ophthalmologists, millions of mothers.
Yes.
And so I do think somehow the PR campaign has
Needs
not
to be
gotten out
better.
there enough.
It needs to be better.
Yeah, what is going on with that? Why?
So it's so interesting because I think that for some reason, it's not a sexy topic, nearsightedness. They don't want to discuss it. This is what we need to be talking about.
It's so
especially
important.
with all the screen time, and we're seeing nearsightedness
Going up, right?
Going up. We need to be talking. If we've got a preventative strategy for it,
Okay,
we can slow the worsening down.
I think the companies need to hire you and I, and we need to go out on the
let's
road.
just do it. We're going to do a little tour. We'll do a nationwide tour.
Because the moms who know, especially because there's such a high likelihood of familial inheritance,
Absolutely.
right? I think the people who have vision like me, easy sell.
It's
no big
easy
deal.
sell, and they've already researched things.
Yeah.
So they've heard of the ortho-keratology. They've heard of the MySight contact lenses, the soft peripheral defocus ones. Which
Some of them I think have. I have to tell you, I meet a lot of people. Like whenever I see someone who's wearing glasses, I'm like, "What's your prescription? Tell me about it." Because I'm like the nosy yenta, but I feel like I have to let them know because had I not had that particular ophthalmologist, I don't think he would have sent me to the first optometrist I went to. So I don't know that even the high myopes really know about it.
For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.